children can learn very early on and very quickly that their ideas or their initiatives are important and are going to be supported and encouraged and acknowledged, right? And when they have that experience, they then continue sharing their initiatives, their ideas, their thoughts, their feelings with their caregivers. And we know this from child development, that when parents watch, wait for, encourage, receive their children's initiatives, meaning a young child makes a sound or moves their hand, right? If a parent sees that, recognizes that, and then either does it back to the child or names it or repeats the sound, the child has the experience of, ooh, wow, someone's with me. I'm being listened to. Ooh, mommy or daddy saw that. I want to do it more. I want to share it more with them. And this is very vital in terms of children's early experiences.
So, Andrew, I know that one of the things you've been coming across a lot with the families you've worked with is around something that you call responsiveness. Can you tell me what you mean by that and what issues the families are having that you're meeting?
Yeah, responsiveness is a big one, um, as you just said, Guy. And the way that I think about it is, I like to simplify. I like to simplify everything about how, as human beings, we learn how to communicate and interact with each other and develop relationships. For me, it helps to simplify things. I believe that in order, and I think research says this a lot, in order to be successful at building relationships with people, at communicating with people, interacting socially with people, essentially we have to be able to do two things. We have to be able to initiate and we have to be able to respond, right? We have to be able to generate um, uh, something from inside of us. We have to be able to communicate, share our thoughts, our feelings, our wants, our needs to another person. And we have to share that information. And then we also have to receive that information from another person. So a way to simply frame it is we have to be good at both initiating communication or interaction, and we have to also be good at responding to another person's initiatives. And if we don't learn to do those things fairly easily or fluidly in social interactions with people, developing relationships socially can be much harder. So when I think of what you framed as responsiveness, what I see happening a lot in my work, especially with young autistic children and their families, is that I see children learning very early on to what I would call become more passive responders. And what I mean by that is children can learn very early on and very quickly that their ideas or their initiatives are important and are going to be supported and encouraged and acknowledged, right? And when they have that experience, they then continue sharing their initiatives, their ideas, their thoughts, their feelings with their caregivers. And we know this from child development, that when parents tune into, um, watch, wait for, encourage, receive their children's initiatives, meaning a young child makes a sound or moves their hand, right? If a parent sees that, recognizes that, and then either does it back to the child or names it or repeats the sound, the child has the experience of, ooh, wow, someone's with me. I'm being listened to. Ooh, mommy or daddy saw that. I want to do it more. I want to share it more with them. And this is very vital in terms of children's early experiences. What I see happening oftentimes in our well-intentioned systems of care in the United States in particular is that what we've done is we've designed intervention or treatment or learning approaches for kids that focused almost exclusively on getting them to respond to us as adults, right? And so what happens oftentimes for young kids and families is children learn very quickly that they need to respond to the adults around them in terms of an adult asking them a question or directing them to do something, or um, giving them a particular word to say. Um, so they learn that paying attention to or following another person is really important. But what can happen very quickly is what they're not learning is my initiatives or my ideas or what's happening inside of me, and my communicating that or sharing that with people is just as important. And that can happen because the adults are trying so hard to get children to respond, and the treatment approaches set it up that way. So oftentimes when parents come in very early after just receiving a diagnosis, they are trying really hard to get responses from their kids. And a huge part of what I'm seeing is that children can actually be incredibly passive and what appears to be almost disengaged from the adults around them, because in part they're not having enough opportunity and encouragement to begin to express and share their own initiatives with the adults around them. And I think this begins to snowball very early on for kids. And again, a big problem is that our entire educational system and intervention system is set up to focus on getting kids to respond in the ways that we want them to respond in the ways that we want to teach them. And I think there are some significant consequences for that.
So we'll come on to those in a second. First, I want to just
Yes.
make sure I understood you right.
Yes.
You're saying that what tends to happen in the relationships between autistic children and their parents is that their parents focus on encouraging them to respond in what they consider to be the right way to whatever stimulus comes at them from the parents or from anybody else. As a result, they don't develop the natural skills that they actually have inside them, but they don't get a chance to develop them, of initiating their own interactions. And because those don't develop and they're not emphasized by the parents, I'm assuming that from that, the parents will then assume, oh, my child's not very good at initiating. The reason being that they haven't seen it. And the reason they haven't seen it is because they've been encouraging the responsiveness too much. And so the child has been tuning into that and responding. So you mentioned consequences. What are those consequences? And then we'll come on to what can we do about those consequences.
Yeah. No, I think you captured it. You captured it beautifully, Guy. I think that the consequences, I think, can actually be quite debilitating for children. And what I see, and I think that again, we're learning more and more about all of these things in terms of research. But in what I observe, and I think we're again seeing this more in terms of later and longer term mental health consequences for conditions. I think what we see happening, and it makes a lot of common sense as well, that if a child learns that their ideas or their thoughts or their interests are not as interesting or not as important to the people around them as learning to say or do the right thing, or learning to do what mommy or daddy want me to do, or learning to do what the teacher or the behavioral therapist or whatever it is wants me to do. What we can see happening is essentially that child's inner life, that child's really authentic thoughts, feelings, interests, desires, stay very much, I'm using my hands as a gesture to say, very much like held back and held inside. And what we know for human beings in general is that when we as children don't have opportunities to share what's inside of us authentically with the people around us and have it received and have it be accepted and validated, um, this can lead to eventually some pretty significant long-term mental health challenges and conditions, such as depression, right? Such as this sense that I've got to hide who I am from the world because who I am is not wanted, is not accepted, is not good, essentially. Um, and I think it can also lead to many different issues that um, you know the neurodiversity movement and autistic folks have been sharing now for many decades, which is this idea of masking, that I have to learn to put on, to basically give the appropriate response to the people around me in a situation, even if it's not consistent at all with what I'm feeling on the inside, right? So there's this incredible disconnect between what a child or what a person is like or feels or wants or is interested in on the inside, and this mask that they're putting onto the world to say, I want your approval and I want to fit in, so I'm going to tell you what I think you want to hear. Um, and I believe, Guy, very strongly that that starts very early on. And I think it's important to say I'm not in any way blaming parents for this, because we live in societies and in systems, and this is particularly true in the US, that where the model of care, especially for autistic children, is dominated by this idea that we need to get children to respond, not initiate, but respond. And when we get kids to respond, we get really good looking data and what looks on the surface to be wonderful progress. If I can tell a child to do something and they do it, if I can get a child to say a particular sentence and they say it based on what I want them to say, things go really well and the program looks very effective. And I think this is a massive blind spot in our that I would actually blame our system for, not our parents for.
But are
So our
are there
parents,
drivers for
yeah,
this that are beyond the system as well? Are there sort of drivers within the sort of family environment? Maybe if the child is not responding at the stage of their development that the parents would expect, and the parents feel, well, at least we can get some sort of reaction like this, at least we can build some sort of relationship like this. Is that something that might also be pushing them in that direction?
absolutely, Guy. I think that's a very important point. That oftentimes when parents are not getting the responses or the connection that they hope for, that they long for, that they want with their kids, many parents try harder, right? In other words, I'm trying in the best way I know how to connect with my child for reasons that many parents don't yet understand. Their child has a different nervous system, can be very overwhelmed and very perhaps more sensitive to social interactions or to sensory information. So their child is holding back or is withdrawing a bit. And so parents then try even harder to get their child to respond, which, to your point, means that they're gonna actually push and force interactions even more. They're gonna ask more questions.
Yeah.
They're gonna try to get a certain response from their child. So this really becomes again a snowball effect,
Yeah.
where the more a child kind of pulls back and perhaps is overwhelmed, rather than the system saying, let's help slow and calm everything down. Let's help you tune into your child more, and let's have more trust in the fact that your child can actually make initiative towards us more if we give them more room and space. If we were to say that more to parents, I think we would have a much more lasting
Yeah.
impact on helping parents and children connect with each other. But
I
that's
can
not the message.
recognize that.
Yeah.
I can
Yeah.
recognize that. I can recognize how easy it is and how satisfying it is to
Mm.
focus on the responsiveness side,
Hmm.
because you get a response and
That's
then
right.
you get that feeling of connection.
Yes.
And I guess what you're saying is there are other ways of getting connection that might require more patience from us, but
Mm.
which are ultimately going to lead to deeper relationships and also to better futures, future prospects, future outcomes for the child. So can you give us some pointers now then
Mhm.
on what parents can do, what practical steps parents can take? What are the things that they might have to be ready to overcome? What are the things they might need to sort of remind themselves about in order to sort of create that, you know, more balanced relationship with their child and evoke more of that child's, you know, ability to initiate?
Yeah. So it's actually incredibly simple and straightforward. The challenge is that it can be difficult to do because of what we've already described, because um, the sometimes our emotions or the pressure we feel to want to try to connect or to want to try to make something happen with our child can in many ways interfere with this very simple set of strategies, we'll call them. And what's amazing in my work that I get to see all the time is sometimes when I explain to parents, just you don't have to do anything. You don't have to make anything happen. You actually just have to show up with your presence and your attention, watch what your child is doing and interested in, and simply name it or put words to it. That's all, right? Parents are like, that there's no way. That sounds ridiculous. There's that's
Can you give an
that's
example?
yeah. So for example, thinking about a particular um, family I was with recently, the very daughter who is not yet two, um, and they were concerned about the fact that she isn't developing the language that they'd like or isn't um, connecting with them as much in kind of everyday interactions or conversations. And so, I talked about just watching what she's doing, and it's amazing because they actually they actually knew how to do that, but in their minds it almost wasn't enough. So what happened in this particular example was their daughter like went to the door of a room that we were in, a clinic, um, and started jingling some keys that were on the door. And as soon as the dad said keys, keys, you've got the keys, um, his daughter immediately flipped around, like she was facing the door, flipped around and immediately looked at her dad's face and smiled. And then she said, ease. She couldn't yet say the full word keys. And then, her dad repeated again back to her, yeah, the keys, you have the keys. And they had this just beautiful exchange back and forth where they were looking at each other, smiling at each other, and actually having what we would call an early conversation about keys. And all of that happened simply because the dad watched what she was doing
Yeah,
and interested in and named it.
yeah,
And that was it. And so what the family pretty quickly, I mean, I think intuitively they got that, but I think what they got to really digest was that they didn't have to work as hard as they believed they needed
yes,
to have connection with their daughter. They just needed to basically convey to her, I see that you're interested in this and I'm with you. And
yeah.
then all of a sudden the connection was right there. They didn't have to they didn't have to work hard for it. And what's so interesting, guys, in many ways that's true for all of us,
Yeah,
right?
yeah.
Yeah.
But it's also really interesting to notice what's going on there for the child, because the child is being validated, because the child's initial interest is being responded to, and it's being made into something, and it's being turned into something that's so rewarding for everybody. child's going to be much more ready to initiate in the future. Whereas, I guess, if we are very much focused on getting the child to respond, and that's where our attention is, the chances are we're going to be not noticing the child's initiations. They're not even going to be on our radar because they're not in our attention. And when that happens, we'll be, as far as the child is concerned, ignoring them. And the child will learn from that without any bitterness or hard feeling, but the child will learn that's not where I go. That's not where fulfillment lies. That's not where I'm going to get relationships from. I need to just stay and respond. And so, in a sense, we're even taking away from the child the opportunity for them to discover their innate strengths.
That's right. That's so important how you just said that, Guy, that we're in many ways we're taking away their innate strengths from them, and we're certainly not enhancing them or building on them. And that's, I think, I think we have a system, and you've written about this. I think you have spotlighted this in your TED Talk and in your book, that we have a system that is very deficit obsessed and focused. And so it makes sense that our approaches, our interventions, our methods of working with kids would be very deficit focused and obsessed. And so what we end up doing is missing, just like you said, we end up not nurturing those simple strengths, those moments of our child letting us know this is what is meaningful and exciting and interesting to me. We miss those because what we're focused on is come over here, sit down, let me teach you something. And ultimately, we override and unintentionally, I think, ignore what our children are showing us they're capable of.
Andrew, do you think you could give us another quick example? I think it would be really helpful.
Yeah. There are so many such examples, and they're actually they're incredibly similar. So I'm thinking about another similar moment where a mom came into our clinic and was really concerned that her daughter was not making the kinds of strides in terms of her language development, her communication skills, her participation in back and forth play, etc. That she knew that a child of her same age should be doing. So mom was working really hard to constantly kind of be one or two steps ahead of her daughter, and kind of trying to what we would call scaffold her play. So she would always say, how many does he have? What color is it? Put him over. Put the like the example I'm thinking of was like taking a car and making the car go down the ramp, right? So the girl was picking up the car and making the car go down the ramp, and mom was, of course, two steps ahead, saying, let's make the play more complex. Let's make the play more challenging. Where's the car going? Make it go fast. Make it go slow. Let's get two cars. Let's get three cars, right? And so mom was so busy trying so hard to come up with all of these different directions the play could go in. And what was happening is her daughter was becoming increasingly passive and frustrated, right? So she was becoming quieter. She was kind of doing what the mom was asking her to do, but her body was very tense, and she wasn't smiling, and she was also kind of putting the car down the ramp much more like almost a bit more quickly and strongly. And so I basically said, I'm just going to try some things here. And this is sometimes where it can be very, very challenging, because parents are locked into a certain automatic mode of interacting with their child, and they've not had anything else modeled for them of how to sort of, do anything differently. So I basically began by not saying anything. I didn't offer a directive. I didn't ask this girl to do anything. I just started very slowly, like picking the car up and handing it to her, picking the car up and handing it to her. And then I just basically didn't touch the car and just kept saying, it's going down really fast, just naming what the girl was doing. And all of a sudden, what started to happen in the interaction was the girl began to look up at my face very quickly, right? All of a sudden, she was like, "Who is this crazy guy?" She was taking an interest in me, in part because I was allowing room and space for her initiatives. I wasn't trying to direct. I wasn't telling her what to do. And what started happening was her play then began expanding. She began to invite me into the play with her, and she began doing much more
Yeah.
of her own um, volition, right? Because she wanted to and wanted to expand the play because she had all these ideas that were typically were not getting a lot of acknowledgement or airtime because her mom was trying so hard to teach and direct. So that's another
So
very
you said
clear
it was
example.
very simple. Is that the formula? You know, you give the child space to do what they want to do. And when they start to do what they want to do, you gently acknowledge it. You
Mhm.
gently just repeat what, you know, just you often say this, just say what's happening.
Yes.
Say what you see and say it in a very welcoming and inviting way.
Mhm.
And over time, the child then sort of gets the idea that actually it's a good thing to initiate. They can initiate. Their initiatives
Yes.
are valid and they lead to positive responses and they lead to positive relationships.
Exactly, Guy. They get the message that your ideas and your initiatives are good
Yeah.
and are fine just as they are. And what I think can happen, and this, I think this does have a ripple effect on our kids developing confidence and
Yeah.
self-esteem, that when kids are learning that the people that have the good ideas in the world are not me, but everyone else, right? The people that have the good ideas are my parents or are my therapist or my my teachers, my all of the professionals in my life. Everybody has these great ideas that they're then offering to me and sort of pushing me to do. Everybody's got great ideas except for me. And so I think this can just start very quickly, very early on for our kids, where they begin to let go of their own ideas and initiatives because they have to fight so hard to try to put them out there because the well-intentioned adults around them are trying so hard to teach and push and make more happen that our kids end up getting a bit left behind.
So with the best intentions, the very best intentions, we are devaluing the child and you know, affecting their self-confidence in quite devastating ways potentially for the future.
Yes,
I don't want to sound dramatic, but I have a tendency to talk in that way. But you know, we're having results that we don't want to have.
yes, yes. I couldn't agree more. And you know, this can be I, I can encounter sometimes a lot of pushback from families and professionals around this. I'm just going to take a sip of water here. Mm. Because what I continue to realize, mm, and I think this is, again, this is a systemic issue and problem, and I think it's particular in the US. I don't think in the US we have a lot of trust and faith and confidence in children's natural and inherent ability to grow and develop. I think we have these elaborate systems of care that are designed to push development, to push learning in such ways that kids end up learning that they don't have very good developmental initiatives. That the way that they naturally are expressing their motivation and curiosity in the world is not so good. And I think this is especially true in the field of autism care. and particularly autism kind of treatment and intervention, that we have this very dominant message that the system sends, that your child is broken, needs to be fixed, and needs very specific techniques in order to, to be fixed. And what can happen as a result is all of these dynamics we're describing of adults doing most of the work, and children becoming, in many ways, passive responders, to look like there's all this wonderful progress happening on the surface. And I think what we're learning from, especially from the neurodiversity movement and community of autistic adults that are brave enough to share their story, is that what we're seeing is that there can be really lingering consequences to this kind of messaging that kids get at very young ages, which is your own initiatives and ideas are not so good, and we need to teach you or train you how to do things the right way.